having me give sort of the doctor or hospital perspective to this event. I'm really honored that he asked me to talk here. My name is, like you said, Sebastian Abdelnur, and I'm the Associate Director of the ER at West Kendall Baptist Hospital. So I look young, but I've been doing ER work for 20 years, and I've been at West Kendall for 12, and the Associate Director there for 8. And through those years, I've had a lot of experiences dealing with police and firefighters and paramedics, and it's really been a great team and team relationship. So I view police, firefighters, paramedics as the tip of the spear in treating patients and helping the people of the community. And you guys played a vital role in those first few minutes when a patient treatment begins. And while I've been lucky these past 12 years to be practicing medicine in a wonderful, supportive, state-of-the-art facility that I call Baptist, I can acknowledge it's a different thing to have to treat patients and deal with people in their homes, on the side of the street, on a park, wherever it might be. So I've seen firsthand your dedication at helping people, and I've also experienced it more on a personal level. So a few months ago, my family personally went through a medical crisis. So my dad's 88, good 88, doesn't look a day over 75. Every single day what he lives for, my mom passed away recently, so he gets bored. But the thing that he lives for is going down to the community pool and hot tub, and he spends maybe every other day over there. And I put a sign on his door, do not go in the hot tub, because they keep that thing at 105 degrees and it's way too hot. So sure enough, it's a July day, he gets into the hot tub, he's all alone, and it's 95 degrees outside, so of course, he overheats, he gets weak, dizzy, and faints in the hot tub. So by sheer grace, there was a neighbor on the balcony who saw that happen. He called 911 and then rushed down to pull my dad out of the hot tub. So as an aside, I want to say, we don't thank Good Samaritans enough, but there's a lot that we all can do on an individual level. If we see something, do something, And that guy, that neighbor, actually saved his life. So luckily, paramedics got there within a few minutes. He was vomiting, his temperature was 104, lethargic, hypotensive. And I don't have a doubt in my mind that those guys and women saved his life. So by the time he was whisked off to the ER, they had given him IV fluids, oxygen, ice packs to cool him down. But beyond that, they took the extra step to find out my number and call me, And so my world had turned upside down, but I was just going through my day and not even realizing it. So that was a great step. So I know what it feels like to get the call, to feel that strange anxiety, the helpless pit in your stomach as you're driving to the hospital, not knowing if a family member is going to make it or how sick they are. On the other side of things, when I put my doctor hat on, the ER can be equally stressful and humbling as well. And that's what kind of makes it so great. Every single patient, every single room has a different story to tell and a different puzzle to solve. And like you all, we have to connect with patients within seconds of meeting them on a personal level to figure out how we can help them and how we can make them get better. So this was my morning yesterday. First patient, Doc, patient in bed 2 has crushing chest pain. Here's her EKG. She's tachycardic to 120. Then I look over to bed 7. He's writhing around, feels, looks like he's got someone stabbing him in his back. He's probably got a kidney stone, which is like the top 3 pain that you could ever feel. So I've got to remember to order him a CT scan, get him IV morphine, Toradol, and IV fluids. I walk past bed 12. She's an older lady who fell at the doctor's office. She's bleeding through her ACE wrap because she's on blood thinners and she cracked her head. And just when I've got all the patients organized in my overworked brain, sure enough, I hear the EMS call overhead. They're bringing a nursing home patient who's confused and their oxygen saturation is 80%. So yes, the ER can be a difficult place to work, and that's why having a great partnership with you all, first responders, is so important. Like I said before, the first few minutes of treatment are so key. In some respects, I'm jealous, because you all get to see a different, more complete side of patients, whether it's seeing the old pictures on the wall, or speaking to family members, and seeing them in their home environment. Some of that humanity sometimes gets stripped away by the time they get to the hospital. So I applaud all of you in this room, and even if I look grumpy or stressed at work sometimes, and I do have to work tonight, that's why I'm in my scrubs and white coat, so I'm working night shift. Don't hold it against me. It's a real privilege and honor to serve this community and work with all of you on the same team. And I thank you for your part saving my dad. And I'm happy to report he's still going to the pool every other day.